Vitamin B5 or niacin is nicotinic acid. It can also be synthesized from tryptophan. It forms the coenzymes NAD and NADP and serves as the acceptors, carrier, donor of high energy hydrogen atom in redox reactions. Its deficiency causes pellagra in human beings. Its detailed explanation can be given later. And it causes black tongue in dogs and foxes. And vitamin B6 or pyridoxine, it's a phosphorylated form of niacin. It serves as a coenzyme in amino acid metabolism. Gluconeogenesis. Gluconeogenesis is production of glucose from amino acids or fatty acids. And it is involved in the synthesis of hemoglobin, myoglobin, cytochromes. Deficiency causes dermatitis, anemia. Convulsions is sudden movement of the body. So, and vitamin B9, it's called folacin. It promotes cell division and it's involved in RBC production, takes part in purine, pyrimidine. Histidine is an amino acid synthesis. Purine, pyrimidine are those building blocks of DNA and RNA. So it plays a central role in carbon metabolism and methylation reaction and forms coenzymes in several reactions. Deficiency causes hypochromic macrocytic anemia, which is characterized by an increase in average size of RBC and RBC corpuscles. And next is vitamin B12. It is called cyanocobalamin or cobalamin. It serves as a growth factor for several bacteria. And it needs to, that is vitamin B12 can be absorbed by the body only if there is an intrinsic factor. It is called the Cassell's intrinsic factor that is required for the absorption of that is cyanocobalamin. And it in human beings, it promotes nucleic acid synthesis, fatty acid metabolism, amino acid metabolism, serves as coenzyme in several metabolic reactions. Deficiency leads to pernicious anemia. Pernicious anemia was first termed as pernicious anemia because it led to death. But now the name is not suited for it, but because it does not lead to death, but its name still persists. That is the name. Pernicious means leading to death. Then coming to vitamin C or ascorbic acid. Now vitamin C is very essential for the formation of all intracellular substances, very essential for collagen synthesis, which maintains that is elasticity of the muscles and skin. It's an intracellular cementing substances essential for the synthesis of intracellular cementing substance and matrix of cartilage and bone. Promotes hematopoiesis as synthesis of the red blood cells. It enhances the intestinal absorption of iron. It helps in the promotion of antibody production. So hence it is very essential for building the body defense mechanism also. Its deficiency causes the disease scurvy in human adults and infantile scurvy in adult, that is children, small children. So which we will deal in detail in the coming slides. Coming to the different vitamin deficiency. This is vitamin A deficiency, that is called as Bitot spots. Bitot spots are seen during vitamin deficiency A. Next is Beriberi. Beriberi is a disease caused by thiamine deficiency. It is found mainly in Japan, Malaysia, China, India, Western Australia and around the Gulf of Mexico. It's common with people who take food which is white polished rice. The removal of the rice bran or the wheat berry will leave the diet deficient in thiamine. So unpolished rice consume ചെയ്യുന്നതാണ് ബെറിബെറിക്ക് ഉള്ളൊരു നമുക്ക് ട്രീറ്റ് ചെയ്യാൻ പറ്റുന്ന ഒരു കാര്യം എന്ന് പറയുന്നത്. റൈസ് ബ്രാൻ റിമൂവ് ചെയ്യാത്ത റൈസ് കൺസ്യൂം ചെയ്യുക. പോളിഷ് റൈസ് കൺസ്യൂം ചെയ്താൽ there will be thiamine deficiency. Beriberi is of two kinds, adult beriberi and infantile beriberi. There are two kinds of forms of adult beriberi, that is, one is wet beriberi and dry beriberi. So in this I have shown the dry beriberi condition. Here, the early clinical effects of wet and dry beriberi is mostly same. The initial symptoms are anorexia. Anorexia we had already seen. It's a loss of appetite. Dyspepsia means indigestion. Pain and numbness in the legs. General weakness and exhaustion. If it is untreated, then it will lead to this type of situation, like emaciation is complete thinning of the body, then inability to speak, and they have common symptoms is loss of tendon reflection, tingling sensation in the feet, etc. All these result from beriberi. Now wet beriberi means there will be edematous swelling, that is swelling of the feet, palpitation, breathing difficulty, rapid pulse, that is low diastolic pressure and high systolic pressure. Now you know that the normal blood pressure is 120 by 80. 120 is the systolic pressure and 80 is the diastolic pressure. So when there is beriberi, then the diastolic pressure or 80 count will go down and the systolic pressure will increase. Heart will become weak and often death follows due to heart failure. Dry beriberi is characterized by progressive wasting and weakening of muscles, wrist drop and foot drop, and difficulty in standing and walking. Death is mostly sure if effective treatment is not taken. There will be cerebral disorders called cerebral beriberi. Infantile beriberi is seen in infants who are born to mothers suffering from high thiamine deficiency. It is common in the Southeast Asian countries where the diet consists of polished rice. There are two types of infantile beriberi, that is cardiovascular type and neuritic type. In cardiovascular type or wet infantile beriberi, it manifests in 2 to 4 month old baby. Its onset is very acute with enlargement of heart, congestive heart failure, high heart rate, high venous pressure, dyspnea. Dyspnea means breathing difficulty and enlarged and tender liver. In some cases, the baby will have cyanosis, that is, it will have a blue face, ears and lips due to improper oxygenation of blood. And pulmonary edema, that is, swelling will develop in the lungs and death may occur in few hours. Neuritic or dry infantile beriberi is a rare disease. It manifests in 8 to 10 month old baby. Most seriously if it affects the central nervous system. Weak and tender calf muscles, low tendon jerks, staring expression, drowsiness, coma are the prominent symptoms. Coming to the next symptom, that is Wernicker syndrome. It is caused by the extreme deficiency of thiamine. It's common among alcoholics. It has a sudden onset and it is characterized by ophthalmoplegia, that is paralysis of the eye muscles. Nystagmus. Nystagmus is a rapid and involuntary movement of the eyeball. Ataxia means loss of coordination in body movement. So it leads to ophthalmoplegia, nystagmus and ataxia. The patient may be unable to stand or walk, and very often there will be mental confusion, anxiety, fearfulness, and even there will be dementia. Next is Pellagra. Pellagra is a disease caused by niacin deficiency, that is vitamin B5 deficiency. For some time before, it was endemic in countries where maize was a staple food. Now maize has a lack of tryptophan. It is from the tryptophan that niacin can be produced. And the disease is characterized by 3 Ds, that is dermatitis, diarrhea, dementia. The other common symptoms of the disease include blisters on the neck, face, hands and feet, inflamed red tongue, stomatitis and cyst in the colon, nausea, vomiting and loss of appetite, poor memory, concentration deficiency, depression, dementia, etc. So the main thing that you can remember is Pellagra is dermatitis, diarrhea, dementia. 3 Ds of Pellagra. Now coming to pernicious anemia, we had already discussed that cyanocobalamin needs a intrinsic factor, Castle's intrinsic factor in the stomach for its absorption. Now, the Cassell's intrinsic factor is a mucopolysaccharide secreted by the parietal cells of gastric mucosa. It is essential for the absorption of vitamin B12. The major signs and symptoms of the disease of deficiency of vitamin B12 is that the abnormally large size and low count and heavy destruction of RBC, very low hemoglobin content and very high bilirubin content in the blood. Due to heavy destruction of RBC, there will be atrophy of the gastric glands, soreness and inflammation of tongue, and numbness and tingling in the fingers and toes. Next is scurvy. Scurvy is called as scorbutus or bleeding gums. It is loosening and falling of the teeth in individuals. It is a vitamin C deficiency seen in human adults. It is characterized by extravasation of blood, which means flow of blood from blood vessels to the surrounding tissue. The symptoms of scurvy come on gradually and its onset is not marked by any profound change. Its preliminary symptoms include general weakness, exhaustion, breathing difficulty, tender gums, and mental depression. Later symptoms in advanced stages include spongy, the bleeding and ulcerating gums, loose teeth with resorbed dentine, extravasation of the blood in skin and elsewhere, swollen and stiff painful joints, bleeding into the joints, nose, alimentary canal, respiratory and urinogenital tract, effusion of fluid into the pleural, pericardial and peritoneal cavities, painful ulcers on limbs, fatal complication in lungs and kidneys. Now, mostly the scurvy appeared during the time when people were sailing from one region to other in ships. During those travels, they had less access to vegetables and fruits. In such cases, the sailors used to die from this disease. Later on, it was James Cook who devised a diet of including vitamin C in their diet. But what happened was that when this vitamin was heated, it was lost. The vitamin C was lost during when it is heated or when it is used in copper containers. So all these led to scurvy or vitamin C deficiency in sailors, and it was later that it was found out that it was due to the vitamin C deficiency that such symptoms appeared. Infantile scurvy is the next deficiency which is seen in infants who suffer from prolonged dietary deficiency of vitamin C. Initial symptoms include pain and tenderness in the limbs. Later on, swelling of the limb, inflamed necrotic bleeding gums, falling of teeth, osteoporosis and bone lesions, beaded ribs, tenderness of the muscle, severe anemia. Due to the pain in the limbs, they will keep a frog-leg position in infants. Then is rickets and osteomalacia. Rickets is a disease of the childhood. It results from the dietary deficiency of vitamin D. Want of sufficient sunlight, fresh air in the dwellings often contribute to the severity of disease. Rickets rarely occurs before the age of 6 months. It very seldom makes its appearance after the age of 5 years. It is most common between first and second years of life and rare after the age of 3 years. Ricket is characterized by low level of calcium phosphorus citrates in the blood and also by the softening of bones. In absence of vitamin D, body may not be able to adequately utilize calcium salts. This causes irregular bone formation and also makes the bone weak and soft. The bones will have severe calcium deficiency, but there will be plenty of calcium salt in the body. The change before the outward manifestation of rickets include disorders of the digestive system, loss of appetite, frequent vomiting and diarrhea, irregularity in the bowels, and convulsions mean involuntary movements, then tenderness of bones, delay in learning to sit and walk. Major visible symptoms of rickets include defective and irregular bone formation, enlargement of the ankle, knee and wrist joints, osteoporosis, that is reduced mass of bones, kyphosis means abnormal backward bending, lordosis means abnormal forward bending, scoliosis abnormal lateral bending of the vertebral column, bow legs, knocking knees are symptoms. Knobed or beaded ribs. It is called as rickety rosary. Deformed chest, that is pigeon chest. Then distorted pelvis, delayed tooth eruption.